Top 25 Phlebotomist Interview Questions and Answers. Welcome to today's video. If you're preparing for a phlebotomist interview, this is the perfect place to sharpen your confidence and boost your answers. Employers don't just want someone who can draw blood, they want someone who can comfort patients, follow safety procedures, and work under pressure with precision and care. In this video, we'll go through the top 25 phlebotomist interview questions and answers you must know. So grab a notebook, relax, and let's begin your journey toward landing that job. 1. Can you tell me about yourself? When answering, focus on your background, education, and experience relevant to phlebotomy. You can say, I'm a certified phlebotomist with _ years of experience working in clinical and hospital settings. I'm skilled in venipuncture, capillary collection, and maintaining patient comfort during the process. I enjoy working in healthcare because I find purpose in helping patients and ensuring accurate test results. My coworkers describe me as detail-oriented, calm, and dependable. I always make sure each procedure follows safety protocols and infection control standards. Outside of work, I stay updated on new collection techniques and laboratory technologies. 2. Why did you choose to become a phlebotomist? You might say, I chose phlebotomy because it allows me to directly help people while working in a clinical environment. I've always had an interest in healthcare and wanted a role that's hands-on, precise, and patient-focused. Drawing blood requires skill, patience, and empathy, qualities I take pride in. Every patient is different, and being able to make them feel comfortable during a potentially stressful moment is rewarding. Plus, I love knowing that the samples I collect help doctors diagnose and save lives. 3. What are the main responsibilities of a phlebotomist? The core duties include identifying patients correctly, preparing them for blood draws, performing venipuncture or capillary puncture, labeling and handling samples accurately, and ensuring specimens reach the lab safely. Infection control and safety procedures are vital. I always follow universal precautions and properly dispose of sharps and biohazard materials. In addition, I comfort nervous patients, explain procedures clearly, and maintain accurate records. Good phlebotomists combine technical precision with compassion and professionalism at every step. 4. How do you ensure patient identification and sample accuracy? I strictly follow the 2 identifier rule, verifying both the patient's full name and date of birth against their wristband and lab requisition. I label each tube immediately after the draw, never before, and double-check that all labels match the order form. I also confirm test requirements, such as fasting or specific tube colors, before collection. Maintaining sample integrity means proper storage and timely delivery to the lab. Small details like this prevent major diagnostic errors. 5. How do you handle a patient who is afraid of needles or blood? I always approach anxious patients with empathy and patience. I start by speaking calmly and explaining each step so they feel in control. Sometimes, I engage them in light conversation to distract them or guide them through deep breathing techniques. I never rush the process and always maintain a reassuring tone. If needed, I allow them to lie down to prevent fainting. My goal is to build trust so the patient feels safe throughout the procedure. 6. What steps do you take to prevent infection during blood collection? Prevention starts with proper hand hygiene before and after each procedure. I wear new gloves for every patient and dispose of them immediately afterward. I disinfect the puncture site using the correct antiseptic and ensure all equipment is sterile and single-use. I never recap needles and always discard sharps in designated containers. Following OSHA standards and facility protocols is non-negotiable. Infection control protects both patients and healthcare workers, and I take it very seriously. 7. Describe your technique for a successful venipuncture. First, I verify the patient's identity and explain the procedure. I position their arm properly, apply the tourniquet, and select an appropriate vein, usually the median cubital vein. After cleaning the site, I insert the needle smoothly at the correct angle, collect the required amount of blood, and release the tourniquet before removing the needle. I apply gentle pressure and label the tubes immediately. My focus is always on accuracy, patient comfort, and preventing complications like hematoma. 8. What would you do if a patient fainted during the procedure? I would remove the needle immediately, apply pressure to the site, and ensure the patient's safety by laying them down or supporting their head. I would loosen tight clothing, elevate their legs slightly, and monitor their breathing and pulse. Once they recover, I document the incident and inform my supervisor or nurse on duty. Preventive care is also key. When I sense dizziness or pale appearance, I act quickly before fainting occurs. 9. How do you deal with difficult or incooperative patients? I maintain professionalism and patience at all times. I never take resistance personally. First, I listen to the patient's concerns. Sometimes they're scared or confused about the process. I calmly explain the necessity of the test and reassure them of my experience. If they still refuse, I respect their decision and report it to the nurse or supervisor. Building trust and using empathy usually help resolve most situations peacefully. 10. What are the most common complications in phlebotomy, and how do you handle them? The most frequent issues include hematoma, fainting, or difficult veins. For hematomas, I stop the draw immediately, apply pressure, and advise the patient to keep the site elevated. For patients feeling dizzy, I ensure they lie down and stay monitored. With difficult veins, I stay patient, warming the arm or trying a different site when necessary. The key is to stay calm, follow protocols, and always prioritize patient safety. 11. How do you maintain confidentiality and handle patient information? I strictly follow HIPAA and institutional privacy guidelines. Patient information is only shared with authorized personnel. I avoid discussing cases in public areas and ensure all records, labels, and forms are handled securely. When using digital systems, I log out after every use. I also maintain professionalism when dealing with sensitive test results or patient questions, directing them to the appropriate healthcare provider when needed. 12. What do you do if you can't find a suitable vein? I take a systematic approach. I start by asking the patient if they've had successful draws before and where. I may warm the area to improve circulation or ask them to make a fist to help veins become more visible. If I still can't find one, I attempt another site such as the hand, but I never exceed the facility's maximum number of tries, usually 2. If unsuccessful, I seek assistance from a senior colleague or nurse. 13. How do you ensure specimen integrity during transport and storage? Proper handling is essential. I ensure all tubes are correctly labeled and stored according to temperature requirements. Some samples need refrigeration while others must stay at room temperature. I also avoid shaking tubes excessively to prevent hemolysis. All specimens are placed in biohazard bags with completed forms before being sent to the lab. Timely delivery ensures accurate test results and maintains the chain of custody for every sample. 14. What should you do if you accidentally experience a needlestick injury? I immediately wash the area thoroughly with soap and water, then report the incident to my supervisor following the exposure control plan. I document the event and proceed for post-exposure evaluation or testing as per policy. Needlestick incidents are serious and must never be ignored, even if the risk seems small. I also review what caused the incident to prevent recurrence. Safety is always my top priority. 15. How do you handle multiple patients when the lab is very busy? I organize my workflow efficiently. I prepare all materials beforehand, label tubes clearly, and follow a checklist to avoid confusion. I always verify patient identity carefully, even during rush hours. Accuracy must never be sacrificed for speed. I maintain a calm attitude and communicate respectfully with patients, letting them know if there's a short wait. Prioritizing critical cases and staying organized ensures smooth operations under pressure. 16. What would you do if a patient refuses to have their blood drawn? I respect their autonomy and never force the procedure. I calmly explain why the test is needed, how it will be performed, and what steps I take to ensure comfort and safety. Often, reassurance helps them change their mind. If they still refuse, I document the refusal and inform the attending nurse or physician. Clear communication and empathy go a long way in resolving such situations. 17. How do you manage time and prioritize tasks in your role? I start each shift by reviewing the list of patients, identifying urgent draws, and preparing supplies in advance. I group tasks efficiently, such as collecting samples from the same area, to save time. However, I never compromise patient care for speed. I use a calm and systematic approach, balancing accuracy, compassion, and efficiency. Prioritization and preparation help me stay productive throughout the day. 18. How do you stay updated with phlebotomy best practices? I regularly attend workshops, continuing education courses, and read materials from professional bodies like the American Society for Clinical Pathology, ASCP. I also follow updates from the CDC and OSHA for new safety protocols. Additionally, I learn from colleagues and participate in team training sessions. Staying current helps me deliver safe, effective, and compliant care to every patient I encounter. 19. Describe a time when you handled a difficult draw successfully. One patient had very small, rolling veins and was visibly anxious. I comforted them first, explaining that I would proceed slowly. I applied a warm compress for a few minutes to dilate the veins and used a butterfly needle with minimal pressure. The draw went smoothly, and the patient thanked me for being gentle. That experience reinforced the importance of patience, technique, and empathy in phlebotomy. 20. What types of equipment and tubes are you familiar with? I'm experienced with evacuated tube systems, syringes, butterfly sets, and capillary collection devices. I know the order of draw, starting from blood culture bottles to EDTA tubes, and the purpose of each tube color. For example, lavender for hematology, blue for coagulation, and gold for serum tests. I always check expiration dates and ensure proper handling to prevent clotting or contamination. 21. How do you deal with errors, such as mislabeled specimens? If I discover an error, I never try to fix it quietly. I report it immediately to my supervisor and follow the facility's error correction protocol. Depending on the policy, I may recollect the sample to maintain accuracy. I also analyze what went wrong, whether it was labeling, communication, or workflow, and take preventive measures. Accountability and transparency are crucial in healthcare. 22. How do you maintain professionalism during stressful shifts? I stay composed by focusing on my purpose, providing excellent patient care. I take short mental breaks between draws to reset and maintain patience. I communicate respectfully with all staff and patients, even when under pressure. Time management, teamwork, and mindfulness help me stay centered. I believe professionalism means consistency, performing at your best regardless of the circumstances. 23. What safety precautions do you follow in the phlebotomy area? I ensure that all materials are organized, sharps containers are within reach, and biohazard signs are visible. I never eat or drink in collection areas and always wear appropriate PPE. I sanitize surfaces frequently and dispose of waste properly. In case of spills, I follow decontamination protocols. Safety begins with awareness. Maintaining a clean, orderly environment reduces risk for everyone. 24. How do you interact with other healthcare team members? I believe teamwork is vital. I communicate clearly with nurses, lab technicians, and physicians to ensure tests are performed accurately and on time. I respect everyone's role and maintain a positive attitude, even during busy periods. If there's a delay or concern, I inform the team immediately. Collaboration keeps the entire healthcare process running smoothly and benefits patients the most. 25. Why should we hire you for this phlebotomist position? You should hire me because I bring a blend of strong technical skills, compassion, and reliability. I'm meticulous about safety and accuracy, ensuring every specimen is handled correctly. I also have a calm, friendly approach that helps patients feel at ease, even those who fear needles. I take pride in representing the healthcare team professionally and contributing to patient satisfaction. I'm committed to continuous learning and dedicated to excellence in every draw. And that's it for our top 25 phlebotomist interview questions and answers. If you found this helpful, give this video a thumbs up, share it with your friends preparing for medical interviews, and don't forget to subscribe for more professional interview guides. Every great career starts with confidence and preparation, so keep practicing, stay calm, and walk into your next interview ready to impress. Good luck, you've got this.